Madam Clerk, are we ready to go?
9 o'clock, yes, sir.
Good morning, everybody. We're going to call this meeting to order. Thank you for joining us today. Please join me in the Pledge of Allegiance. Ready to begin?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all for being here. And I'll remind everyone to please speak directly in your microphone to ensure your comments are heard clearly and by those in attendance as well as those viewing the live stream. If you're presenting or called upon to contribute, please come to the podium. Please silence all mobile devices. Thank you. And we're going to do roll call.
Thank you, sir. We do have a confirmed absence for Chair Karen Spiegel. Vice Chair Kurt Hagman.
Here.
Supervisor Gutierrez.
Here.
Supervisor Rao.
Here.
Member Anderson.
Here.
Member Williams.
Here.
Member Zorn. Thank you.
Thank you. We have a quorum. Any changes to the agenda?
No, sir.
Any public comments on the agenda?
No, sir.
And any conflict of interest by any of my colleagues? Seeing done. We have consent items 1 through 28. Does somebody want to pull an item off? Is there any public comments on items 1 through 28?
No, sir.
Entertain a motion for that? We got a motion. Second. All those in favor?
Aye.
Any opposed? Motion passes. We'll move on to policy agenda and status.
Pardon me,
report.
Chair. I'm sorry. We do need the meeting minutes. I didn't hear you mention the meeting minutes in
Was
that.
that item 1 or what item was it?
That
Yeah.
was the beginning. That was item.
Before the consent.
Will you add that to your motion, sir?
Yes.
And the second? Second.
Thank you, sir.
There we
Thank you.
go. Thank you. Move over to our CEO update.
Thank you so much, Vice Chair Hagman. Great to be with you folks today. It's hard to believe it's June. Time is just flying by, and boy, lots to share with you, but we're really excited about some particular updates and wanted to start off with a mission moment with you. This happens to be from our mission conference that we just completed. I know that some of you folks were able to make it. Thank you so much to board members Zorn and Williams for being there. Just a really fun day, very, very much of a highlight day with Dr. Barry Bittman, who's the CEO of the Omaha Music Institute Foundation, there with Mike Grayson and Drew Tritek, just doing some incredible music for us. A physician-musician program is what they call that. And they did a great job, along with Dr. Tate Shanafeld, who's from Stanford University, the Chief Wellness Officer, talking about provider well-being. Just an awesome speech that he shared with us, and rounded it out with Dr. Cherie Prentice, who is a physician that talked about never taking any moment for granted and living in the minute. And just a wonderful, wonderful day. We also had 4 unique awards that were given that day. Our Mission Award winners, which were DAP Health, Overflow Farms, Dr. Gutierrez Go, and of course the Never Stop Grinding team. And it was just a very, very inspirational day. Really appreciate the board's support for this, and a great way to be reminded of the work that we do and why we do what we do and how we do what we do. So really wanted to just say a big thank you to that. Up next, I wanted to just share with you our monthly membership numbers there. You can see for June, we're climbing towards that 1.7 million mark. I thought that we might hit it. I thought we might get there, but of course with July being the redetermination month that things will start to hit, we could see, of course, that decrease starting. We would see a decrease. We'll see a decrease here in July coming up next month. Some great work, though, happening with our counties. I'm going to talk about that here in just a minute, but wanted to make sure that you saw the membership numbers and to make sure that you knew that you'll start to see a decline, of course, over the next 12-month cycle as we get into that re-eligibility and redetermination process. On the next slide, really wanted to say thank you to the San Bernardino County team for inviting me up to the city-county conference. Really appreciate Supervisor Rao and Leonard Yost and the San Bernardino County Transportation Authority for having me there. We had a great time. I was on a panel discussion there with, you can see the panel folks that I was joined there with, and really enjoyed that conference, that time together, and just learned a tremendous amount. I actually learned a lot about the investments that are happening in the county, thanks to the Transportation Authority and the work that they do to try to make sure that they're finding dollars that support all of the infrastructure here in our county. It was very, very good. I really enjoyed that. So big thanks to the county for having us up there. I thought I'd also share with you an exciting project that is happening, and really, I'm thrilled about this. This is right in downtown Ontario. So just a few blocks from here on East D Street. So we've got a really cool initiative that's happening thanks to a partnership with the University of La Verne. And you'll be seeing a formal write-up on this next month, but I wanted to just give you a preview of this. One of the biggest questions that we get asked at our provider dinners is what can we do as a health plan to support our providers with staff? These are medical assistants, CNAs. Of course, the hospitals are constantly looking for central sterilization techs, rather. And I am just so pleased that this worked out for us to be able to support this, and really wanted to say thanks to Supervisor Hagman for his passion on this and support on this. And Supervisor, I'm not sure if you'd like to share a few words, but it was really cool thing.
No, first of all, thank you for the team, IEHP, to work with the University of La Verne. I think we all recognize the labor shortage, and especially projected going out, and we all need to be partners in this. The University of La Verne is donating a lot for a new facility. This is a new venture for them, and IHP to provide scholarships. It's wonderful to partner up, just like we do for our medical school as well for our physicians. Will be a little fun part of it is the announcement came on the La Verne Scholarship Night, and I swore Jared to secrecy before we went there. So the poor president of the University of La Verne was like texting and calling every other day for like 2 weeks. What'd you guys find out? What'd you guys find out? I don't know. So she came up, it's like, what scholarship? And her face just dropped completely because she was going to make the big unveil that night. And then we said, yeah, just keep teasing, bring Jared up, and he was able to make that announcement. So thank you for playing around with that as well. But no, it's a great program. It's going to be on the West End where we have a lot of population as well to hopefully get them trained up to great careers coming forward.
Yeah, really a great time on this. And I should note, the cool thing about these dollars is on the scholarship side, there's actually a time requirement for those students that receive the scholarships to stay in the Inland Empire after they complete those programs to make sure they're here caring for the community. So really appreciate that.
And I understand, and I'm hoping not jumping, but I saw in an email train that they're talking to IHP about possibly using this facility while the construction goes on for the new building. So I don't know if
That's right. Yeah, we're looking at that as well. So lots of excitement there for our medical professionals and to support the providers and clinics here in the region. So many, many thanks on that. On the next slide, I thought I would just share with you a real testament to the work that's in this space of redeterminations across the country, and IHP considered a best practice on that process and with re-eligibility and redeterminations. Our very own Thomas Pham was part of a presentation that you can see there that was a national presentation on navigating the complexities of Medicaid redeterminations, and just wanted to give a shout out to Thomas for his work on this. There's no doubt it takes a village on this. Everybody's been involved on our team from every single executive member that's shared ideas and thoughts to the folks that are on the front line actually executing the plan, but just really wanted to say thanks to Thomas and his work on that. Also wanted to say a big kudos here on this next slide to Jania Fick and her team in quality serving under Ed John. You know, we no doubt have the best team in the state, if not the country, that's focused on the mission of the organization. We have an incredibly talented team in quality, and you'll hear a little bit more about that later today. But Jania had a chance to share with the California Association of Health Plans And you can see all of the different items that were discussed there. But she's such a incredible cornerstone for this work in the state, and I just wanted to give a big shout out to Ginny. I think Ginny might be here today. I don't know. Is she not here? She's, oh, shoot. Well, Ed, you'll have to just tell her. We were really bragging about her today. So, and Vice Chair, that completes my report. Happy to try to answer any questions if you have them.
Thank you, Jared. Any questions of our CEO? If not, we're going to move over to Keenan, item number 30 for results for audit.
Yep. So we're going to be reviewing our audited financials for calendar year 2022. Moss Adams will provide an overview with Aparna and Ashley presenting.
Okay, here we go. Good morning. Thank you for having us. We're happy to be here to talk about the audit results. On the next slide, we'll just go through a brief agenda. We'll just refresh the board on the audit process. We'll highlight some of the areas we gave attention to as far as kind of the significant areas of the audit, run through our required communications, and take any questions along the way. Next slide, please. So for the year, just the scope of services, we were engaged to audit the financial statements for the year ended December 31st, 2022. Separate from the audit process, we also did provide some non-attest services, and this is really more just to provide transparency on what those were. So we assisted management with drafting the financial statements, except for the management's discussion and analysis. That is a document management controls and prepares. And for this year, for the year ended 2022, IEHP does also have a single audit requirement because of the grant through the County of San Bernardino. And so we will be working with management to finish that single audit piece. That part of the audit is still in progress. We're wrapping that up this month. And then there's a filing process that IEHP has to go through to submit that audit for the federal agencies, because the dollars that came from the county were passed through the county to IHP. That's why the single audit requirement is in place. It's that filing process later this month when we finish the single audit. Next slide. So in terms of just the audit process, we had shared a plan via a letter earlier in the year, and so we were able to execute on that plan. There were no deviations or any significant concerns or exceptions with that plan. And so we were able to get the information and the support we needed to conclude on our audit, and we issued the audit report on April 26th. Next slide. And so in terms of just the areas that we focused on, these are really the areas that are very inherently subjective, require a lot of management judgment, require a lot of assumptions as far as just predicting future events. So the first one is just around the capitation revenue and receivable. And really the piece here that is subject to estimates is a lot of the retroactivity that happens and rate changes and all of that can happen throughout the year. And so we test the controls around the membership reconciliation, even without the redetermination process in play, just making sure that the state is providing accurate membership information that IHP can be using in the analysis is an important control, so we test that. We also then test that the revenues are being recognized with the latest rates and membership information. Any kind of retroactivity that's happening during the year, we're understanding what the inputs are and how management approached calculating if there is especially a reduction to revenue or an increase to revenue, making sure we understand the methodology and the inputs. And then lastly, to the extent cash receipt data is available, we also looked at that. And so based on all of that, we didn't note any concerns or any exceptions. The other big area is, of course, around the medical claims payable and other medical liabilities. And so we spend a lot of time testing the controls around the claims cycle as well as the provider capitation payment cycles. We also look at the data that the actuaries use to calculate the claims liability. And then also with the provider capitation, we look at actual payments subsequent to year end to test whether or not management's estimate, again, was looking at all the data available at that time. We also look at the experience of the actuary, making sure that they're nationally reputable, they have the experience necessary to be doing the calculations, and we noted no concerns with that. And then we also do a retrospective review, so we look back to the previous year to see what's the gap between the estimate recorded then and the payments made out? And why that's important is to be able to test the methodology itself, making sure that management is consistently calculating the claims liability the same way every year and using the data the same way every year. And then lastly, we also look at, separate from the IBNR and the claims process, amounts that are due back to the state, whether it's for retroactivity, for the risk corridors. We look at the nature of the amounts, we look at the calculations and the data used. And so based on all of these things, we were able to conclude there was no exceptions or no concerns. Next slide. And then as far as now, we're going to just switch over into kind of the required communications piece. So for the auditing standards that we use, we are looking at making sure we're expressing that opinion that the financials are in accordance with accounting principles. And because IEHP is considered a special district in California, the state auditor's minimum audit requirements also apply here. And really, it's making sure that we're able to express that opinion, and our responsibility is to do that, and management's responsibility with your oversight is to prepare the records and the financial information that we audit. And separate from that, this year, because of the single audit requirement, there is a schedule of expenditures of federal awards. So that is called a supplementary schedule. It's not required to make the financial statements accurate in accordance with generally accepted accounting principles, but it is required by single audit standards. So we also express an opinion on that schedule, kind of in relation to the financial statements, that it's using the same set of accounting records and they agree to information already included in the financial statements. Next slide. And here, just referencing the audit standards we use, so the generally accepted auditing standards, and the state controller's minimum audit requirements, and the new set of standards this year because of the single audit is the government auditing standards. All right, next slide, please. And lastly, as far as internal controls go, we do look at internal controls with the purpose of being able to design our audit plan and also to make sure we're able to express an opinion based on that plan, but we aren't specifically expressing an opinion on internal controls. So we're not doing that, but if we do note any concerns with internal controls, it's our responsibility to bring it up to the board's attention. I'm happy to spoil it and say we have no such things to talk to you about. So we always have some good best practice recommendations, but nothing has ever come up that we think is a serious concern or gap in internal controls that management needs to fix or correct. Next slide, please. And separate from that, if there are any other matters that come to our attention, we need to make sure we're communicating that with you. And so I already talked about this briefly, but just pointing out again that it's new this year to have that single audit and the extra schedules that go into the financial statement package that will be filed later this month. And so just making sure that you're aware that that's a new part of the audit this year. We expect that'll probably also happen for 23, just because of the timing of the grant. So there'll be one more year of talking about some of these things that are new, and then going back to sort of how the audit was done before. Next slide, please. All right, Ashley, you're up.
Good morning. We are to communicate significant accounting practices utilized by IEHP, including accounting policies, management estimates, and financial statement disclosures. In regards to the accounting policies, there were no changes in the application of existing accounting policies. However, during the year under audit, IEHP did adopt new accounting policies relating to the standard GASB 87, which just relates to the presentation of leases within the financial statements. The application and adoption of these accounting policies did not have a material impact on the financial statements overall. In regards to management estimates, the most significant estimates affecting the financial statements are noted here on the screen, with kind of the biggest ones were the items that Aparna was mentioning before that we had audited. Next slide, please. In regards to financial statement disclosures, the most significant disclosures within the financials are premium revenue, cash, cash equivalents, and restricted cash, medical service contracts, defined benefit pension plan, commitments and contingencies, and then subsequent events. Next slide, please. The next few slides are just required communications to conclude on our audit. There were no significant unusual transactions identified during our audit. Next slide. There were no significant difficulties encountered during our audit. Next slide. Happy to note that there were no disagreements with management throughout our audit. There were no circumstances that affected the form and content of our audit report. There were no findings or issues arising from the audit report, no other findings or issues. Happy to also note that there were no uncorrected misstatements noted. There were no material misstatements identified as well. Great news. And then upon issuance of the financial statements, we did obtain certain management representations, which are maintained in a signed management representation letter, and an executed version of this letter is available upon request. Next slide. We are not aware of any instances where management consulted with other accountants about significant auditing or accounting matters. And no significant issues arose during the audit that we have not already addressed. And this slide and the next slide just summarize some additional communications if necessary. However, if you don't mind going back to the last slide, thank you. There's nothing to note other than there were no material weaknesses noted and no significant deficiencies to communicate to you. Next slide. Again, nothing to note here. Next slide. And thank you for your time. If you have any questions, I'd be happy to answer them.
Thank you. Any questions for board members? I will say that we all sit on multiple boards, and every year we go through the audit process, and always, it's a really thick book. And you jump to the last pages, and what you want to see is no significant findings, no material on the backside, and you go, okay, we're good. And we know here in IHP, Keenan and his team does a fantastic job. So it's great that you didn't find anything that we usually don't find. So thank you so much, and congratulations, Keenan, for keeping the book squeaky clean as usual. Any questions for our team? If not, this is, yeah.
Were there any recommendations, like, for improvement at all that you noted?
No, we didn't. We didn't actually have any this year. And we try our best to find something because we want to. We want to say, hey, FYI, have you thought about this? Really, the team here runs a very tight ship, and there's a lot of eyes and double checking and triple checking of information. So, yeah, we don't actually have anything this year to report.
And also, remind us of how many staff do you interview in terms of getting information from different staff?
We talk to a lot of the folks in the finance and accounting team, depending on their area of responsibility. And then also outside of that, we talk to folks within the claims team, the actuary team. We also interact a lot with the legal team. It's essentially anything that might even indirectly impact the financial statements. We also talk with the IT team to understand the IT environment. So it adds up to quite a few people by the time we're done, yeah.
Good, thank you.
Thank you. It's receive and file. Thank you, ladies, and thank you for your team's work. We're going to move on to the monthly financials with Keenan after that stelling report, right?
It's definitely the team. Just want to thank Leona and Hong and the rest of the team, Carol, for a great job on keeping our financials in order. So the next item is the monthly financials for the month of April. For April, we had a positive net surplus of $52.9 million versus a budget of 16.8. We had a positive variance to budget of just over 36 million. Year to date, we have a positive net surplus of 181.8 million versus a budget of 82.7 million. We have a positive variance to budget of just under 100 million. As we've talked about really for about the last 8 or 9 months, we are headed into redeterminations in the July board meeting. We'll present our first breakdown of our membership losses for both counties, the potential impact on that, and also the potential interruption in care for people who were under the supervision of a provider and lost their eligibility. So we'll talk a little bit about that. Nothing major to report this month on the financials. Any questions?
Any questions for anybody? Nope. Thank you, Keenan. Another good month for us. We'll move on to item number 32, approve the Leadership Retirement Intention Program. Keenan's also going to support this, but do you have to read it in directly?
Yes, I do, sir. Thank you.
For the presentation?
Yes, sir. Thank you. The recommended action for this item is that the governing board of the Inland Empire Health Plan approve the Leader Retirement Retention Program for the provision of a 5% retirement benefit for eligible leaders, including the Chief Executive Officer. Thank you.
Keenan, you're up.
Okay, so on page 109, we're going to talk about the Leadership Retirement Program. The purpose of that is retention for IEHP's leadership staff to work on, the various strategic items that we have out there, including Covered California, the plan itself for strategy, and then also our redeterminations that are coming up and a number of other initiatives. We do feel like this will potentially reduce recruitment costs, which are about $1 million for the last 4 years at the leadership level. So we do think this will help retain our leaders and cut into that cost. It'll also make us more competitive with other local plans in terms of total compensation. On the next slide, just to give you some guidelines, it's an employer contribution of 5% into the eligible leaders 401A retirement account, and it will vest after 5 years of service. The eligibility for the program will be our leaders, directors, and above, including our CEO, who are eligible for CalPERS benefits on or after January 1st, 2013. The program will begin and the vesting will begin on 7/1 for the existing leaders, and then for those leaders that are employed after 7/1, it will begin on their first day of employment. For any leader who leaves within their 5-year vesting program, they will lose 100% of the 5% match. That lost match will go to offset future matching for other leaders or offset administrative expenses. In terms of fiscal impact, on the next slide, the average expected cost is $1.1 million per year. The total cost after 5 years is expected to be around $5.5 million. In terms of the number of leaders that are eligible for the program, as of June, we have 78 leaders, and then we do have 11 leadership positions that are currently in recruitment. So the last page there, the request is for the board to approve the Leader Retirement Retention Program, and the eligibility will include all leaders, directors, and above, including the Chief Executive Officer. Any questions?
You can report. Any questions? We've all kind of been through this. Yeah.
So many people that retention of the leaders that we have is becoming even more critical and a concern, not just for us, but lots of people right now. So this seems like a timely time to do something like this. It'd be helpful for us to understand if this impacted it, if this made a difference. So as follow-up, I would just ask that you keep us posted as to whether or not we're making some strides, and are we accomplishing what we were hoping to do with this over time?
Okay, we
Thank
can
you.
do that.
Yeah, it's a great new program, but we need to get the updates as we implement it and see how that affects the numbers and be able to reflect back and make sure the policy is supporting our premise that we start off with. Yeah, please.
Could I get maybe this forwarded to Jeff Van Wagen from Riverside as well? I think it's a great thing. So I'd like to see if we can do something like that in Riverside. Thanks.
Sounds good. This is the action items. We need a motion.
I'll make a motion.
We got a motion and a second. Dan and Supervisor Gutierrez?
I'm sorry, I got the motion, Supervisor Gutierrez. The second was Dan Anderson. Thank you.
All those in favor?
Aye.
Any opposed? Seeing none. Great job.
Thank you.
We'll see how that works out. Okay, item number 33, and the clerk will read this one off too, but it's going to be presented by Dr. Joan.
Thank you. The recommended action for this item is that the Governing Board of the Inland Empire Health Plan approve the funding for the 2023-24 Leadership Quality Achievement Program for IEHP leaders. The budget amount for this program is set at $4.4 million with a payment distribution in July 2024.
Great. Well, good morning, members of the board. And, over the past several board meetings, we've heard all of your collective support in helping us here at IHP improve quality performance. And what we've come up with in response is a new Leadership Quality Achievement Program offered to directors and above, specifically and solely focused on improving quality performance. So today I'm excited to walk you through this program, and as I do, what I hope you recognize is that it was intentionally designed to help us as leaders move the needle on quality. Next slide. But before I jump in, I think it'd be important to provide some background and context on what we currently offer all our IHP employee team members today. So today, we currently offer a 5% team member bonus to all our IHP team members. And the goals of the program are spread across the 6 domains that you see on the screen right there. It's spread across member and provider satisfaction, mission connection and process improvement, and preventive and chronic care. And what we recognized is that there was not only a need to keep this team member bonus program intact, because it addresses key corporate objectives for us, but also recognize an opportunity to create an additional achievement program focusing only on quality measures. Because as you see on the grid there currently only are 2 quality measures in preventive and chronic care. So what we wanted to do, again, was to create an additional program focusing on many more measures and making sure that they're distinct from the ones that are offered in this program. Next slide. And this new program would be a 15% leadership quality achievement program. And again, it would be offered to directors and above. And the goals would be to enhance collective accountability on quality measure performance, to strategically align priorities among department leaders, aligning towards common quality goals and outcomes, and to promote cross-functional collaboration so that teams such as Takashi's health services teams and Susie's operations team and Michelle's marketing team, Keenan's finance team, Vanille's IT teams, and our quality team can partner even more closely than before. The program would focus on both quality improvement and quality achievement, and I'll go into those specific details in the upcoming slides. And the program would ensure alignment with our regulators' priorities, including the Department of Healthcare Services, the Department of Managed Healthcare, Covered California, and the National Committee for Quality Assurance. Next slide. So since this leadership program will be based on our 2023 quality results, we've structured it in a way so that in terms of eligibility, it will be offered to IHP leaders defined as directors and above, hired before October 1st of this year and employed on June 30th of next year. In terms of value, it would be a maximum payout of 15% of annual salary, again, based on our 2023 quality outcomes. So if a leader had less than a year of service in the role of director or higher, their payout would be prorated. And in terms of the payout dates, it would be distributed in July of 2024, which is consistent with our regulatory reporting schedule. And what I'd like to call out, is that what we're proposing with this 15% additional leadership achievement program is that it's consistent and at market parity at the 50th percentile compared to incentives offered to leaders in other healthcare and healthcare payer organizations of similar size. And this is some of the work that Mercer, our compensation consultants, helped us arrive at. Are there any questions before I go into the specifics of the program? Okay, great. We can move on to the next slide. So we actually had over 80 quality measures to select for this program, and where we landed were on these 7 measures that you see on the screen. And we selected these 7 measures because it prioritized measures focusing on mothers and children with a sizable volume here in the Inland Empire. These 7 measures reflect things that are prioritized and aligned with our key regulators, and you can see in the very far right-hand column, who those regulators are. And we've included measures that were both thematically linked from a care perspective and also inclusive of measures that we've historically had a hard time moving the needle on. And I think it's important to mention that this list of measures does not mean that we won't focus on the other 70-plus quality measures that we have to report out on as a health plan. I think we're going to be focusing obviously on every single quality measure that we're accountable for here at IHP. I just say that these represent a nice cross-section and a starting point for an achievement program like this. Next slide. So in terms of the payout methodology, the 15% payout will be based on our 2023 performance on the 7 selected quality measures, where each would hold an equal value of 2.14%. And within each measure, there will be 2 distinct goals. There would be 1 improvement goal and 1 achievement goal, each worth 1.07%. And over the next several slides, I'll be going into more detail about what each of these goals mean. But at a very high level, I'd consider the improvement goal, to be something focused on year-over-year improvement. And the achievement goal would be something focused on how we're doing compared to other plans in the country using a national percentile benchmark. And in the best case scenario, if we were to hit all our improvement and achievement goals for every measure, we'd be able to achieve 15%. And this 15% total maximum payout would be $4.4 million. And I think one of the reasons we felt that as an executive team that it would be important to budget $4.4 million for a program like this is because we want to develop a new type of accountability with our leaders when it comes to working towards quality outcomes and goals, again, ultimately leading to better outcomes for the members that we serve. Next slide. So what I'd like to do now is review our achievement goals first. And I know there's a lot of numbers on this slide, but I'll walk through it because it's pretty simple. And I think what's important to call out is we had to use our 2022 performance rates for this slide as an illustrative baseline because we don't have our 2023 rates yet because we're still halfway into the year. But what you'll notice in the light green colored column are our performance rates for each of the 7 quality measures. And then what you'll notice in the peach-colored columns on the right of them are the different national percentiles with their cutoff points. And for this program, we've defined our achievement goal as the next highest percentile cutoff that's at least 1 percentage point away. So for example, if you look at the very top of timeliness of prenatal care, using our 2022 rates for illustrative purposes, our 88.1% performance would put us right underneath the 75th percentile cut point. But because we're less than 1% away from this benchmark, we felt that stretching ourselves to the next cut point at the 90th percentile national rate would be appropriate in terms for us for achievement. Or as another example, if you look at childhood immunizations combo 10, which is second from the bottom, our 28.9% performance rate is a bit away from the 50th percentile rate. And in this measure example, setting the 50th national percentile as our achievement benchmark would be quite the achievement. So this is the methodology that we took for each of these 7 measures. And next slide. As you can see on this sort of summarized slide, when it comes to achievement goals, we have some measures where we're looking to achieve and exceed national performance beyond the 75th and 90th percentile. And then we have other measures where we're looking to get to the average 50th percentile. But at the end of the day, our goal here at IHP is to be above the 90th percentile in every single one of these measures. But again, this is a starting point for us for a new program like this. Any questions about the achievement methodology before I go on? Okay, next slide. So now I'll review with you the improvement goals. And the big reason that we also want to include improvement targets is because it represents year-over-year continuous improvement from our baseline. And this is something that we track, our regulators track, and something that we felt will keep our team members engaged in a program like this. And the methodology for this is straightforward. the quality improvement goal would be set at 75% improvement between our 2022 baseline and our desired benchmark. And it will be determined by looking at the gap between IHP's baseline 2022 performance and the desired achievement goal in 2023. We then calculate what a 75% improvement in that gap, and then set that 75% improvement rate as the improvement goal. And we've circled in the purple box what our 75% improvement rates would be for each of the measures. And I think one thing you may notice is that in the world of quality, we deal with a lot of percentages, and sometimes these percentages equate to small windows. But it's important to recognize that even within these small percentage windows, it equates to quite the lift in the amount of effort that we have to provide to actually meet those marks when it comes to providing care for our members. So for example, if you look at child and adolescent well care visits, which is the third measure from the top, a 75% improvement would require us to jump from 46.6% to 47.9%. And even though that this jump is only 1.3%, it might not seem like a lot. To put that into context and what that translates to for us as a health plan is that we need to ensure that about 7,300 more well-child visits are delivered in our region. Or as another example for immunizations for adolescents at the very bottom, a jump from 34.5% to 38.0%, again, might not seem a lot, but what that means for us as a health plan is that we need to ensure that about 1,100 adolescents would need to be compliant with their immunizations. So I hope walking you through these examples, especially around the percentages and the volumes that we need to engage our members in, is why these improvement goals would also be considered a stretch for us. Next slide. So this slide just summarizes on one page what both our improvement and achievement goals will look like. And again, I think it's important to note that we'll have to update the numbers on these slides once we get our 2023 benchmarks. But we anticipate that they should be hopefully directionally similar to what you're seeing right now. So I hope walking you through our methodology for this program, shows that, this isn't an arbitrary program with arbitrary targets. We've modeled it in a way that it really stretches us so that we can move quality performance for the members that we serve. And if anyone is curious to see what our sort of outcomes would have looked like if we implemented this exact program last year using the exact same methodology based on our 2022 rates, we would have only hit 3 achievement targets, are actually 3 improvement targets and 2 achievement targets, yielding about a 5.35% achievement. So I think I just share that as an example because the 15% is hardly a give me. And again, in 2022 for us, we actually improved on a lot of these measures. Next slide. So in conclusion, again, the program is designed to improve care outcomes for our members. It focuses on meeting and exceeding our regulatory requirements so that we can avoid sanctions, and it enhances the way that our teams work within and also with one another so that we can move the needle on the measures for our mothers and children. And we recognize that this is a new program, so we'll be sure to be keeping the entire board informed of the progress along the way, and we'll bring back in Q4 of this year what our updated 2023 rates look like. And again, we welcome your continued feedback and support and insights as we go on this journey. And a call out at the bottom is that we recognize that this program is right in the middle of our redetermination process and that the redetermination could actually impact how the program is structured. So if we have to make any changes or revise the program goals and structures, we'll be sure to bring it back to the board for review and approval. Last slide. So again, we really thank the entire board for considering this program for us here at IHP, and just want to thank you for the time. And as Annette mentioned, we're looking for board approval on this Leadership Quality Achievement Program.
Thank you for the presentation. I know we've been going through a lot of background to get to this point. It is cheaper to incentivize than pay sanctions, so that's good too. And plus, our clients are getting better care and more focus. I have 2 quick questions for you. One, what kind of updates can you do internally to see if you're on the right methodology or track to get to these goals? And then secondly, for anyone to answer, it's not just incentivizing a director, but it's the departments, the team that does this. So what other kind of resources do you have? Let's say you need to do more advertising, and we got to do a big email push campaign. That's going to cost dollars or resources. Or we need to start putting people on Saturday phone calls, and we have to pay overtime. What other kind of tools do those departments have to actually attain the goals?
So we've started on that process already. So to your first question, what we've been doing internally as a quality team is looking at every single one of these measures, trending our performance, for example, in 2022 compared to how we're doing year to date, and actually going into the details of each of the measures to understand why we're seeing some of the improvements we're seeing or why we're not seeing as much improvement we'd like to see. And we call that our root cause analytics work. And we've started working on that already with some of our key leaders, including Susie, Takashi, and a lot of help from our finance teams and Keenan, so that we could get more dialed in to help move the needle. And in that root cause sessions, we've also identified new quality improvement initiatives to address some of the gaps or improvement opportunities. And from those learnings, there are initiatives that have come from it, such as more education, such as ways to improve billing or coding, or things we could do from an IT perspective to capture more data, or things that we need to do specifically with our providers from a clinical operations perspective. And one of the things that we plan on doing as a department in quality is to share and socialize that broadly with all the other leaders and all the department heads, so that they also recognize and understand the background and context of what we're finding, and for us to gain their insight and feedback and wisdom as to what they might consider things that they could do at the department level, so that we can see some of the improvement that we're seeing. And we'll start rolling out that quality dashboard, at the end of this month, and we'd be happy to share with the board as well, kind of what that sort of month-over-month trend looks like.
And I would just, I know this is our experiment, and we're getting more private sector-ish with this, which is good. And I'm hoping that as we get our 2022 numbers back in, that's something that the board can be part of for the following year. So does this need authorization every year, or is this a permanent part? How do we have that process of selecting what those 7 out of the 80 components may be, and working with staff to figure out what the following year goals would be?
So I think in terms of program design, we absolutely would welcome your feedback on, the measures that we're proposing for the following year. To your point, there could be more measures, less measures, depending on how we're doing, how our communities are receiving the service, and the priorities of our regulators. So I think what we can bring back to the board is, at least for 2023, we can start with these measures, just because that's what our regulators have really doubled down on in terms of accountability. But moving forward for the future year measures, we'd absolutely bring it back for review and approval in terms of the types of measures we include.
But is this a sunset program, or is this an ongoing program?
Yeah, for us, the way we're sharing this today is that it would be an ongoing program built into the budgets of each year, but that the board would have to approve the measure set each year and actually also see the actual outcomes each year. But that's really your discretion. But that's what we're thinking today, is that we would be in the board budget process. So at the end of this year in December, you'll see it listed for the 24 budget, but then all of the measurement set would actually have to come here, be approved, see the outcomes of how we did previous year and whatnot. But that's obviously at your discretion.
Any other questions? Yeah.
Couple. I appreciate very much the intentionality and the integrity with which you put together the description for us, so that we understood why you're doing this and also what you're hoping to accomplish. I know in past quality reports, it's very clear that many different types of attempts have been made to really, as you said, move the needle. And this is one that had not been tried as yet. And I think we're all very hopeful that this will definitely make a difference. Also appreciate the fact that the items that you've chosen for this first novel approach, if you will, are those that really are high concern to us. But again, I think we'll learn a lot through the course of this over the first year, and then can make adjustments as we go.
And Supervisor Hyman, I would just note, I think what you shared kind of hit the nail on the head for me. You know, first off, of course, we're tired of being in sanction land. I know you folks don't like it. I don't like it. We've got another round. I don't know when, Ed, that list is coming back out from the state, but I think it's pretty soon. We'll probably be on it. It just drives me crazy that that's the case, especially because they don't factor in some of the unique things for the Inland Empire compared to some place like Santa Barbara. So we're working on that piece with the state on making sure that that Healthy Places Index is included, or some type of a factor to acknowledge that we have one of the biggest provider population ratio shortages in the state of California. I think right in the middle is Kern County, and then it's San Bernardino and Riverside counties kind of donuts us. So that point is true. And I think to your point, Board Member Zorn, we have a very robust, as you folks know, pay-for-performance program for our primary care physician, OBs, hospitals, and IPAs. We've never done something similar to that for the leadership piece to really get us all aligned and on that same straight and narrow path. And while there are other incentive programs for our sister plans in the state, public plans, none of them have a absolute honed-in, focused, laser-pointed pinpoint on quality like this does. And that does make us unique, I think, in a good way, to get us not only off that sanction list, but more importantly, to drive results for our members. So I just wanted to point that out as well, that to your point, it is another, just another stair step in all of the different things that we're trying and the different publics.
Could you review again for us, Dr. Dunn, the time frame in terms of when we'd hear back from you likely as to how things are progressing with this?
Absolutely. So we'll bring back in Q4 when our 2023 benchmarks are released to us from the state. In the world of quality, our timelines are a little bit delayed in the sense that even though we're in the middle of 2023 currently, our regulators will share with us what our 2023 benchmarks and cut points need to be in about September, October of this year. So we'd be happy to bring back in Q4, once we get those rates, an updated grid on sort of where we're heading and targeted towards.
It's good. We're looking forward to the new venture here and see how it works. But I think it's critical that, I believe in our directors and supervisors that they're above human here, but they still need the resources to be able to explore different ideas, to implement those new ideas and new ways to reach out to our folks. So with that, without any questions, we'll take a motion on this.
I would move to approve.
Thank you, Dan.
Second.
Second by Eileen. You get a first and second. All those in favor?
Aye.
Any opposed? Seeing none. Congratulations on that. There's no IEHP health access business. Any comments from the public on matters not on the agenda?
No, sir.
Thank you. And any other board member comments before we leave? No? No closed session today, so we are adjourned. Thank you all for coming.
I would have lost a bag, so.